test to predict increased mortality risks in COVID-19 patients. A new COVID-19 test may help determine hospitalized patients at risk of mortality. The test has been developed by scientists at the Massachusetts General Hospital. The indicator this test looks for is inflammation. This is based on the early reports from China, wherein some patients had extreme inflammatory responses. The higher the inflammatory response is, the greater the risk of premature death. Dr. John M. Higgins, the study's senior author, said, "We wanted to help find ways to identify high-risk COVID patients as early and as easily as possible." According to Medical Express, the test measures the red blood cell distribution with or RDW. RDW is a standard diagnostic blood test. It can tell about the size or volume of red blood cells. If a difference exists in the size or volume, it may indicate complications or symptoms associated with an illness. Many diseases and disorders have an effect on the level, size, and volume of cells in the blood. In the study, a total of 1,641 adult patients diagnosed with COVID-19 were included. They were admitted to hospitals in the Boston area between March 4 and April 28, 2020. Scientists analyzed the patterns in blood tests performed on patients. They found that elevated RDW was correlated to relative risk, or RR, of mortality across all ages. The RR among patients was 2.73 with a mortality rate of 11% in those with normal RDW, but 31% in those with elevated RDW. For patients younger than 50 years, the RR was 5.25 with a mortality rate of 1% in normal RDW and 8% in elevated RDW. Among patients aged between 50 to 59 years, the overall RR was 2.9 that represented an 8% mortality rate in normal RDW and 24% in elevated RDW. Among patients aged between 60 to 69 years, the RR was 3.96 that reflected an 8% mortality rate in normal RDW and 30% in elevated RDW. But among patients aged 70 to 79 years, the RR was only 1.45 compared to previous age groups. Still, 1.45 RR had a mortality rate of 23% in normal RDW and 33% in elevated RDW. And finally, among patients aged 80 years and older, the RR was 1.59 that translated 29% mortality rate in normal RDW and 33% in elevated RDW. Scientists concluded that elevated RDW at admission time and an increase during hospitalization could be indicators of mortality. They published their findings in JAMA Network Open.